Hello, respected Team MF4 aristocrats. Welcome to the third and the final edition of Phosphosin Communication Update. In this edition, our focus shall be to highlight superiority of phosphosin, our brand of phosphomycin, over various other antibiotics in the management of UTIs. So let us start. The first antibiotic we are going to have a look at is nitrofurantoin. Let's have a look at how phosphosin scores over nitrofurantoin. Let's have a look at the shortcomings of nitrofurantoin first. In case of pregnancy, there needs to be a precaution whenever nitrofurantoin is prescribed for managing UTI. Nitrofurantoin is not recommended during the end stage of pregnancy. Also, there's an enzyme called G6PD. In case of deficiency of G6PD, in such patients also, nitrofurantoin is not recommended. There is no such recommendation for phosphosin. Phosphosin is extremely safe in pregnancy. In fact, the European Association of Urology guidelines uh, also presents the fact that phosphomycin can be prescribed in first trimester, second trimester, as well as third trimester, because there is no precaution associated with phosphomycin whenever it is going to get prescribed in pregnancy. The second disadvantage of nitrofurantoin is it is multi-dose therapy. It has to be prescribed for multiple times in a day and for multiple days. And here is the beauty of phosphosin. Phosphosin is a SAT dose therapy, a single dose therapy whenever the doctor is going to prescribe in the management of simple UTI. So this is how phosphosin scores over nitrofurantoin. Now let us move ahead to the next molecule. The next molecule we are going to focus on is amoxicillin clavulanic acid. Amoxiclav, a market more than 2000 crore. But here also phosphosin scores over amoxicillin clavulanic acid. Let us have a look at what are the shortcomings of amoxiclav. First, amoxiclav has a high rate of resistance, and this is the precise reason many of the recent guidelines are not recommending amoxiclav in the management of UTIs. Second disadvantage is again it is a multi-dose therapy. It has to be given for multiple times in a day and for multiple days. So both the places phosphosin scores over amoxiclav, while amoxiclav is having high resistance, is having least chances of resistance. While amoxiclav has to be prescribed for multiple dose for multiple days, for simple UTIs, phosphosin has to be prescribed for a single dose. So again, phosphosin scores over amoxiclav as well. Now let us move to the next molecule. Phosphosin also scores over cephalosporins. Cephalosporins get widely prescribed in the management of UTIs. Few of the cephalosporins which are very regularly prescribed, I'll just give an example. Cefixime, again a huge market. Cefixime plain is close to 900 crore. Cefixime combination market is touching 2000 crore, almost 1800 crore. So again, Cefixime is prescribed in the management of UTIs. Here, cefixime or I'll say cephalosporins are having a lot of drawbacks, lot of shortcomings. Let's see what are the shortcomings of cephalosporin and what are the advantage of phosphosin. Here, with cephalosporin, there is medium to high resistance. So again, resistance is catching up with the cephalosporin. So whenever doctor prescribe a cephalosporin, maybe a cefixime or a cefuroxime, there is a chances of treatment failure. But for phosphosin, there is the least chance of resistance. Second shortcoming of cephalosporins is multi-dose therapy. So it has to be prescribed for multiple times in a day and for multiple days. Here again, fosfomycin course of cephalosporin it has to be prescribed in a single dose. A single dose and has to be prescribed in the management of UTIs. So again, phosphosin scores over cephalosporins as well. Now let us move to the next molecule. Phosphosin scores over quinolones as well. Various quinolones like ofloxacin, ciprofloxacin, norfloxacin are getting regularly prescribed in the management of UTI. But let us have a look at the shortcomings of quinolones. Quinolones are having lot of health warnings. So there are, in a recent past, there are a lot of health warnings which are associated with quinolones. But here, fosfomycin is extremely safe. It is a pregnancy category B drug, so it can be given even for pregnant patients safely. Fosfomycin is also safe in vulnerable patients, old age patients. Fosfomycin is safe in patients whose kidney and livers are not functioning properly. There also fosfomycin is very, very safe. So while quinolones are having health warning, fosfomycin is extremely safe for all patients. The second shortcoming of quinolones is there's a lot of resistance with quinolones. Here also, phosphocin scores over quinolones. Phosphocin has least chance of resistance. The third shortcomings of quinolones is it is a multi-dose therapy. Again, here phosphocin scores over quinolone as phosphocin needs to be prescribed in a single dose whenever the doctor is managing simple UTIs. So if you see fosfomycin scores over nitrofurantoin, phosphocin scores over amoxicillin clavulanic acid, phosphocin scores over cephalosporins like cefixime, ciprofloxacin. Phosphocin also scores over quinolone like ciprofloxacin, norfloxacin, ofloxacin. So a huge UTI market presents a huge scope or huge potential for growth for phosphocin sachet. Let us enhance that. Now going beyond that, Fosfomycin brand phosphocin is advocated in wide range of UTIs. Let us have a look at the indication very quickly. Phosphocin is recommended in the management of simple UTIs or acute lower UTIs, and the dosage is 3 gram single dose. Phosphocin is also recommended in the management of resistant lower UTIs. Here, the dosage is single dose of 3 gram administered on day 1, day 3, and day 5. Phosphocin is also recommended in the management of UTIs during pregnancy or asymptomatic bacteriuria. Here, again, the dosage is single 3 gram dose. Moving ahead, phosphocin is also recommended in the management of recurrent UTI. Here, the dosage is 3 gram single dose every 10 days for 3 to 12 months. So, a 3 gram needs to be administered every 10 days for 3 to 12 months. Phosphocin is also recommended in the management of prostatitis. Here the dosage is 3 gram OD, that is once day for one week, followed by 3 gram every 48 hours. And the treatment duration is for 6 to 12 weeks. So imagine in the management of prostatitis, a single prescription is going to give us a huge benefit in terms of huge sales return, sales generation. Now let us move ahead. Phosphomycin brand phosphocin is also recommended in the management of catheter-associated UTIs. Here, the dosage is very simple: 3 gram once a day for 2 days, followed by 3 grams every 48 hours for a total treatment duration of 2 weeks. Beyond that, phosphomycin is also recommended in the management of gonococcal urethritis. Here again, the dosage is very simple: single dose of 3 gram administered on day 1, day 3, and day 5. Let's move beyond these indications. Phosphocin is also recommended as a prophylaxis. Prophylaxis in traumatic endourological intervention or surgical procedures. Here the dosage is phosphomycin 3 gram, 3 hours before the surgery and 24 hours after the procedure. So again, I'll repeat, the dosage is very simple. In traumatic endourological intervention, surgical procedures as a prophylaxis, the dosage is phosphomycin 3 gram 3 hours before and 24 hours after the procedure. And if the procedures are simple diagnostic procedures, the prophylaxis and diagnostic procedure is phosphomycin 3 gram single dose 3 hours prior to the procedure. So it's a very, very simple dosage regimen for phosphocin and wide range of indications. So if we see phosphocin presents a huge opportunity of prescriptions in wide range of indications. Phosphocin can be prescribed in the management of acute cystitis, which are also called simple UTIs. Phosphocin can be prescribed in the management of recurrent UTIs, resistant UTIs, UTIs during pregnancy, Urethritis, gonococcal urethritis to be precise, catheter-associated UTIs, prostatitis, prophylaxis in urological procedures or surgery. So there are wide range of indication in which we can generate prescriptions for phosphosin. So if we summarize the last few slides which we have seen, we can easily say that the UTI specialist phosphosin offers a huge potential of growth to us, a huge potential of growth to team MF4 aristocrats. So our humble request is let us encash the potential for continued success for phosphosin. With this, we wish you all the best for continued success for phosphosin. Thank you.